Hello and welcome to eMediCore Patient's Corner series. Today's discussion is on ureteral stents. A ureteral stent is a small, soft plastic tube that is placed inside a ureter, going from the kidney down to the bladder. One end of the stent stays in the kidney and the other end stays in the bladder. The end of the stent has a shape that curves like a J shape. Hence, it is known as a double J stent. Unlike a heart stent, which is permanently placed inside the heart, the stent needs to be removed or replaced after a certain period of time, usually weeks or months. This is a diagram of a double J stent. Notice the two J-shaped ends of the stent. Why do I need a ureteral stent? It can be placed after certain surgical procedures on the ureter or kidney to ensure proper drainage of urine from the kidney during the period after surgery. A ureteral stent can be placed to relieve obstruction of the kidney due to such conditions as kidney stones or tumors in the ureter or stricture, narrowing of the ureter. What are the benefits of a ureteral stent? It can help ensure drainage of urine from the kidneys. The ureteral stent may also help relieve pain caused by obstruction of ureter, such as stones in the ureter. In such circumstances, the stent stays side by side to the stone. The stent drains the urine from the kidney so that the patient may have immediate relief of pain, even though the stone may still be present in the ureter. The stent can also help the ureter heal properly after surgery or injury. The risks or complications of a ureteral stent. Some of the risks or complications of having a stent may include the stent malfunctioning, the misplacement of the stent, meaning not in a good position. In this case, the stent can neither function nor drain the urine well. The stent may cause irritation to the bladder, and the patient may have the urge to urinate often. It may also cause pain or discomfort during and shortly after urination. Furthermore, the stent may cause pain in the back or in the kidneys just before, during, and after urination. Here, we see several pictures. One is a diagram of a urinary tract with a ureteral stent placed inside. The other two images are J-shaped ends of a ureteral stent. Why does the stent cause pain in the kidney during and after urination? Normally, the urine flows from the kidney to the ureter down into the bladder in a downward direction. There is a valve at the entrance of the ureter into the bladder. This valve prevents the urine from refluxing or going backwards into the kidneys when the bladder is full or during urination. In a patient who has a stent, the ureteral stent keeps that valve open, therefore preventing its closure. When the bladder is full or during urination, the pressure is brought through the stent up into the kidney, causing the kidneys to swell. The patient may experience pain from the swelling of the kidneys. In order to avoid pain and discomfort with the stent, the patient should urinate often to keep the volume of urine in the bladder low. This will lessen the pressure that is transmitted to the kidney. During urination, the patient should relax and try not to strain. If the patient strains while urinating, the pressure in the bladder is increased, and that pressure can be transmitted through the stent up into the kidney, which can cause even more pain. How does the doctor remove the stent? The stent can be removed in the office under local anesthesia using a procedure called a cystoscopy, which requires looking inside the bladder. In certain circumstances, your doctor may leave a string attached to the stent. This string will allow for the removal of the stent by pulling on the string. What can I expect after having a ureteral stent? You may expect to have some discomfort or mild pain in the bladder during and after urination. Mild pain in the kidney or flank also known as the back, is also common. You may also have frequent urination and occasional urinary leakage. If the discomfort, urinary frequency, and urinary leakage are too severe, you can call your doctor, who can prescribe you medications to alleviate those symptoms. Call your doctor immediately if you have chills or fever over 101 degrees Fahrenheit or 38.3 degrees Celsius, severe or excruciating pain, severe vomiting or nausea, or heavy bleeding. It is common to see some slightly pink urine, but heavy bleeding, like ketchup, is not normal.
eMediCore, core medical education. For everyone.
From everywhere.
Forever free.